Can we effectively treat depression among people living with dementia? And the answer is yes. When it comes to dementia, more than 95% of people experience neuropsychiatric symptoms like apathy and anxiety and agitation, and so on. Apathy being one of the earliest symptoms of dementia as it relates to neuropsychiatric symptoms, meaning mental health expressions of a brain disease like a dementia disorder. But what we do know is that when we treat depression, even in the context of a dementia disorder, that this helps the person as well. Let's talk about how. One is it eases suffering. Two, we can help the person implement some scaffolding to help them live a full, meaningful, independent life for as long as possible. We can help to connect them to communities of other people living with dementia disorders, like with Dementia Alliance International. A few years ago, I did an interview with Chrissy Thelker, who is a woman living in Canada who has a diagnosis of dementia. And she came on talking about her experiences with a dementia disorder, but she talks about how powerful the community she has with Dementia Alliance International, which is an international group of individuals with dementia who created this organization. So it's founded by people with dementia, for people with dementia, run by people with dementia. We can help connect people to psychiatry and neurology to help manage some of the neuropsychiatric symptoms that can come with dementia so that they experience less suffering and maybe build a better quality of life. We can also provide support and resources and therapy to caregivers, to family members who are coming to terms with understanding how to constantly calibrate their approach with their loved one living with dementia so that they don't overstep when the person with dementia can still maintain things independently, and don't understep when the person with dementia needs more supports in place. And so when it comes to therapy, I hear many therapists say, a person has dementia, there's not much I can do with them if they have depression. And that's actually a false narrative. There is a lot that you can do to help the person with dementia manage depression and live a good life. Therapy can help reduce the person's distress, increase their quality of life, improve their relationships with family members, and help the person find meaning and purpose and dignity in the life that they have now. Family therapy with older adults and their loved ones, which is my favorite type of therapy, also helps to improve care and reduce burnout. So the next time you think that the person has dementia, there's not much you can do, rethink that and think about all of the possibility that exists.